In a book I'm reading for the third time, titled Golds by Brian Tracy, he writes of research that was conducted to determine what qualities are most needed for success and happiness in the 21st century. Now, the extensive research concluded that the most important single quality that we must develop at this time, in this era of rapid change, is, John, flexibility.
Flexibility, and that's so true. Really. Well, considering the explosion of information and knowledge in every era, it will be unwise to stay fixated and refuse to be constantly open and alert to new ideas, information, and knowledge.
True. And with that food for thought, if you would call it that, let me quickly and happily welcome you to another, to our world of change and flexibility. It is the family-focused arena where everything, and I mean every subject on the surface of the world, is, as far as is related to the success and well-being of every member of the family, is discussed and tabled.
Yes, the weekly family talk show is Today with John and Helen, live every Saturday morning with repeat broadcast Saturday night and Sunday morning. I remain yours truly, John Senaya, and thanks for joining us.
And I look forward to being here every Saturday, believe me. Now, how have you been? How is Nigeria dealing with you? And how are you coping? Well, Helen Odele is still my name, and you're welcome to a great and rewarding conversation today.
Yes, and we have a great package for you today. First, let's take a quick break, and you get comfortable and stay connected, and we'll see you in a bit.
All right, thanks a million for staying tuned. We're told that oral health is the window to our overall health. And you may ask, what is the link between oral health and your overall well-being? Our first guest, Moyo Sorry Awonusi, is a dental surgeon, and he's happy to fill in all of the gaps that you have, all of the questions that you may be having about your dental health matters during this conversation today.
I forgot to bring my cane onto the show today, Helen. Okay. So we're talking to Dr.
That's between you and I.
Yeah, I want to see.
I want to see, yes.
So today's show offers two guests, actually, and the conversation will be engaging and very impactful. That we promise you. After the timeout with Moyo, the dental surgeon, we shall make way for Fabia Ugumekon, a legal practitioner and development consultant, to critically take another look at the topic, the gender agenda, the scorecard so far. So you can guess that we'll be talking about women again.
The gender agenda, not only women, come on. Now, of course, the conversation will be punctuated with some vital breaks, spicing the package with more information, entertainment, and enlightenment. And if you're ready, we are, because our first guest is right here.
So, what is the connection between oral health and some major life-threatening diseases? Let's hear it from the expert in this field.
Okay, and so, where did you say? Sorry. I want to see is a dental surgeon with several years of clinical experience and under a decade of leading and participating in medical and dental community outreaches. He works with the NGOs, public and private investors. He's a graduate of the College of Medicine, University of Lagos, and our guest today currently practices at the dental clinic of the Military Hospital here in Lagos. Please join us to warmly welcome Moyo Sorry. Hi.
Hi.
How are you?
Fine.
Okay.
Fine.
The teeth is talking. Okay.
I wish I could smile
From
like
the dental surgeon.
you know, because, well, okay. So we're talking oral health care. You know,
Well, we must know.
and what we need to know on the topic. And I'm sure that our viewers, you know, will be all ears, you know, to know, hey, let's demystify this thing, you know, for a bit. So, Helen, you want to fire the first salvo?
So let me fire the first salvo. What are the essential daily dental care habits that everyone should follow to maintain good oral health?
Okay. So, at the start of a new day, because as we all wake up in the morning, start of a new day, the first thing that goes to your mind is you want to get clean. You want to clean your mouth. So ideally, you should wake up in the morning. When you wake up in the morning, you brush. Take your medium textured toothbrush.
Medium textured
toothbrush.
Not hard.
Not hard. Unless you smoke.
What does the hard do?
To be honest, the hard...
You feel cleaner when you use it. So, you think you feel the teeth feels cleaner.
You think. That's what you think.
You think, yeah.
But the truth is, the deposits on your teeth, that's plaque and calculus. Once they are on your teeth, they are on your teeth. You know, using hard brush doesn't really do much but damage the soft tissues. Eventually, even the hard tissues. Now, you will notice that people who use hard brushes, over time, their gums begin to recede.
Wow.
And then it seems like their tooth is getting longer.
No way.
You know, so you begin to see the root of the teeth. What has no business being out there?
They're even doing more damage.
Yeah, doing more damage.
But why is it in the market? What is the use? There has to be a use.
It's the illusion of the satisfaction that you are cleaning your... Now, if a smoker, you know, smokers, a coffee users, cola nut eaters, green tea addicts, you know, black tea. So when you have that, you have those stains, and then you feel like your medium texture toothbrush is not doing the job. So you. But that takes us to the next thing. How often do you see your dentist? Every 6 months. So when you go every 6 months, you do your ultrasonic scaling and polishing, or your manual scaling and polishing. Yes, every 6 months. That's twice a year. So those stains that your medium texture toothbrush can take out, we take out.
Helen,
okay.
I don't want to confess how long overdue I am for cleaning. So it's actually every 6 months?
Every 6 months.
Wow.
Twice a year.
Okay.
So outside, if we don't do that, what are the risks? What happens if you don't see your dentist like maybe for 5 years running?
Is that a way?
So it was just like you said, like we said before the camera started rolling. You have a small hole, very tiny. Because it's not giving you any issues. It's in the first layer of the teeth. By the way, let me quickly just give in small anatomy. The teeth has 3 layers. The outer layer stronger than bone, see-through, kind of like glass. Then the inner layer is a bit softer, made of tiny microtubes. Then the deepest layer has blood vessels and nerves. So that is the softest part. So when you have a hole in the teeth, it begins to penetrate layer by layer. And it starts subtle. It's the most subtle, but
you won't even know it.
When it comes, it hits you, boom.
That's when it touches the nerves.
That's when it touches the nerves, and it gets worse from there. And meanwhile, the tooth communicates with the bone because it's in the bone, so it could get even worse from there. So when you have that, if you don't come and see your dentist, we can spot it. We are trained to spot these things. So that's just one of it amongst several. So early detection saves you your hair, and then it saves you money.
So you've talked about when you wake up in the morning, you brush. Then you've talked about seeing the dentist 6 months, every 6 months at least.
Yes, sir.
Then what else are we? Basically, should we know about our health, oral health?
Oral health. So there are other practices you can engage in, which is when you wash, or you eat, rinse your mouth. When you also eat, use your floss. Now, when it comes
to toothpicks.
Not toothpick. Now, when it comes to the issue of floss, what is out there is you have the plastic, which has one pointed end on one side, and then one side with a thread. That's in the market. Your conventional toothpick you sell at your pepper soup joint, the wooden one, you have that in the market too. And then you also have a threaded floss,
the threaded one.
which is my floss of choice.
Okay.
Yes, because the tooth is inside the bone, but it's not inside bone like it's glued to the bone. No, it's held by cords.
Okay.
And those cords are in the gum. The gum just covers everything, but those cords are inside.
Yeah.
So when you use your plastic, when you use your wood, you're expanding those cords and destroying the bone over time. And the more you dig in, the more germs follow.
Oh.
And they will also do some
They have their
destruction.
own.
So you are creating a pathway for them to go deeper and deeper. And in no time, your tooth starts wobbling, starts shaking.
So the nylon floss.
Yeah, the threaded floss
is the one that helps you safely
just takes it out.
It just takes it out.
You know, I'm just looking at him because last night I was fighting. I have the plastic one, but I prefer the you get now. And this crazy small refused to come out, and it was like a battle until it just dawned on me: just go to the bathroom and rinse as many times, you know,
as possible.
And that's what happens to all.
And the thing just small.
There's also new technology. There's one that's high speed water.
Okay.
Just
we'll come to the new technology, because I know that there are new trends.
Yeah, there are new trends.
But before we leave these basic things that we must do, there's a school of thought that says, at least maybe some of these people who are teaching us healthy living and all, that when you wake up in the morning, do not brush first. Drink your water. Plus the deposits from the previous night. It also helps in cleansing.
Drinking water is okay. Hydrate.
Without brushing.
With or without brushing, you're fine. I don't think there's any issue.
Okay. So now, many people like me only visit the dentist when they have pain. So how often? You've said it's 6 months.
It's every 6 months. That's twice a year.
Is that the meaning? Is that the...
You want to come more often?
No.
I want to have more time to
like once a year or twice or once in 2 years. He wants to.
The standard is twice a year. Every 6 months.
The standard is
standard.
I just thought I should confirm that because we just said every 6 months. So it's still twice a year, which is like every 6 months.
Why do you think that a lot of us, and it has nothing to do with enlightenment and knowledge and, why do you think people are laid back when it comes to, dental care or oral health, going for checkup?
Okay, so statistically, dental care is linked with urbanization. It is linked with educational level.
Okay.
So you find that people who are more educated tend to visit the dentist more than people who aren't.
Okay.
Yes. So there is a link. There's a link between knowledge.
We are uneducated.
No. I'm going somewhere.
Okay.
But
I know.
Doesn't mean it moves you to action. I'm just saying statistically. You find out more people because you will find more dentists, more dental clinics in Victoria Island than you will somewhere in. Okay.
Okay.
Don't you think there's a default there? Because if you had them more in the rural areas or in communities, rural communities, then it is in their faces. Then the knowledge and the information is.
They have to, I don't know.
Then you have, what about culture? Education itself is a culture. You're exposed to people who at certain levels you think alike. But in those areas, they think alike. You can establish dental clinics and people be walking past every day, going to put agbo, or touch and go, and rub it and spit out and be passing. Speaking their language, they don't understand, delay, and all those things. So, so there's a link between level of education, urbanization, finance. That's your the economy.
Power. Okay.
Sorry, I have to jump in here, Helen. I'm sorry. Now, don't you think that culture, I'm not looking at culture, cultural practices. I don't want to put down our traditional practices, like the local
chewing stick.
Yes.
You'll even find that the so-called educated people, after brushing, they still use that.
Yes.
How do we balance it out? Do you want to speak to the use of local means of cleaning?
What's in it? Medicinal? Is there some?
It is actually. Studies have shown that your local chewing stick actually has herbal contents that are good for the gums. Even things like cloves.
Cloves, yeah.
Fine.
You say fine.
No, it's fine. But the issue now is back to the nature of this thing. Like, the tooth is not stainless steel. It's an organic tissue, you know. So by the very action of doing that, you are damaging. The toothbrush is an amazing technology. As simple as it looks, you know, with the right technique, it helps you preserve your teeth for as long as possible. I tell my patients, I say, even if you use iron sponge, I will still extract your tooth if you use iron sponge. Yes, because you are not supposed to use it. The gums are soft. The enamel is hard, yes, but over time it can wear out. So when you are using your toothbrush, your chewing stick, you will see it in our patients, gingival recession. The gums have gone inside. That action of
gingival recession.
It's called recession. Just means
that is
it's going back.
Bacteria.
The gums are
okay, it's receding.
It's receding.
Wow.
So over time, you just take your tooth out. No matter how healthy the gums look, because but interestingly, some toothpaste brands, they started extracting the herbal content and putting it in there. So that's nice. If you find any.
Some people use charcoal for whitening. Demystify it, please.
Okay, so this is one thing I noticed. I've used charcoal before growing up. That's, you know.
Okay.
When I was very young, we were playing up and down, and somebody said, "Oh, use charcoal, your teeth will be nice." And I was like, "Okay, nice." So we got charcoal, and then growing up, I've always loved black tea. I don't like milk in my tea.
Okay.
So I always had those things.
Okay. Residues.
Charcoal took them out.
Charcoal took them out.
Took them out. That's as far as I know, as it helps with tooth whitening. But it's also hard. It's also abrasive. That's as far as I know.
Yeah.
But anything else, I don't think it helps. It doesn't. To whiten the teeth means to, you know, it's more like an acid attack on the teeth.
Okay.
Personally, I don't really recommend it, and I'm saying this on air because it has its own side effects.
Okay. I was going to ask you can I get my teeth white?
Yeah, you can actually, but there are also measures you put in place. Because like I said, it's a chemical attack on the teeth.
It's like
I would say chemical enhancement, if I were to be more, you know, friendly to the profession. Because we do it. So it goes in and then it you know, enhances the brightness of it. But it also puts you at risk of having sensitivity to that cause we do fluoride therapy. So we put fluoride in the teeth. That will help minimize the amount of sensitivity you feel. Over time,
That's interesting.
You know, the human anatomy is just awesome. When you begin to think about it. Now, diet does play a crucial role in oral health. Which food would you say promotes strong teeth, and which should we avoid?
Okay, so the teeth, hard tissue, like the bone. Hard tissue needs calcium.
Okay.
Yeah, so now your tooth is on the outside. You know, your smile, everybody sees it. So the tooth gets nutrient from the blood supply. That's where the calcium comes in. Your milk, your meat, your normal. So you get dairy. Your dairy is one of the richest contents when it comes to calcium. So you take dairy, you have calcium there.
That's milk?
That's milk.
Cheese.
Cheese, yes. Okay. Some will say fish bone, soft bone, biscuit bone. Calcium. Yeah, you can get something from there. that aside, I will come to bone later. Because bones, to the abrasive nature and your grinding over time, it wears off the enamel.
And I love bone, man.
Especially the biscuit one.
The biscuit bone.
The biscuit one.
Absorbs the flavor. Yeah, so that aside, then diet. Okay, but I would say calcium, yes. That calcium containing foods, yes.
And they are?
They are.
Yeah.
Your dairy, your I think your nuts, not too sure. But,
Okay.
and then your meat, yeah. Your fish.
Okay.
Yes. But food to avoid, I think, is more important than food. If you have a well-balanced diet, you should get your basic nutrients. But food to avoid is that which is, commercially profitable to the multinationals,
okay.
but detrimental to the health of those consuming it, which is your sugar.
Sugar. Hey,
But I'm told that there's sugar in everything that we eat.
Yeah, but refined sugar. Let me make it specific. The ones that are stripped of their complexities.
Okay.
And then it boils down to your white granulated sugar.
I love sugar.
I'm
such a sweet tooth.
Continue to love sugar.
Now, let me just break it down quick in a very simple. So when you take sugary stuff, everybody has bacteria in their mouth, billions of them, to the point where the way God made it, it's natural. They are supposed to be there. They have their function. So you take your sugar, let's say you take a bottle of Fanta, or you eat dodo, very ripe dodo, it's sticky, and it's on your teeth. And over time, drinking water, talking, and you go to bed, wake up. So this is what happens when you go to bed and you don't brush.
Okay.
Acid is formed. How? It's not, in the local setting, they say kokoro, it's kokoro that is causing the, but it's to an extent, yes, it's a microorganism, but what does it do? So that small, plantain in your teeth, you go and feed on it. They are hungry, they will eat. They are living organisms, they must eat. Your Fanta, they will eat on it.
Your sweet,
Anything refined sugar, they will feed on it. So once they feed on it, they produce acid as a byproduct. That acid now softens the teeth. Just makes it soft. So that enamel that we say is the hardest substance in the body softens it. So over time, the more you take, the more you... Now, during the day, the acidity varies. During the day, we are talking, drinking water, eating, having conversations, stimulating salivary flow in the mouth. The saliva on its own reduces the pH. So it brings the acidity level down. But when you now go to bed, you are not doing anything but just your mouth is closed.
Sure.
So what you're saying that is a must to clean your mouth.
Yes, ma'am.
Even if you're unable to brush.
Even if you're
do something to get out those particles left over by whatever it is you have had, whether a bottle of Coca, bottle of whatever.
Bread.
I don't want to advertise
Soda.
bread. Wow.
Oh, that's rinse. If you are too tired, I recommend you brush. Some people, that's where mouthwash is coming. You're too tired. Do something. At least mechanically remove something.
Yeah. Wow. Okay, so now I want to dig in a little bit more. I'm concerned about cavities. You have the cavities now. Okay. So tell us, because fluoride is often mentioned in dental care. What role does it play in preventing cavities? And are there any risks of excess fluoride? Because I remember years ago, almost every toothpaste advert, had fluoride, something about fluoride. Is there any, downside
to it?
This fluoride stuff?
Okay, so I would still say we are now at the time where it's war of the multinationals. The brands that are making this toothpaste, they are at war. So some will say, some that are making non-fluoridated toothpaste will say the toothpaste is the ones without fluoride are also very good. But this is the science behind fluoride. Fluoride binds with the teeth and makes it very hard and more resistant to acid attacks.
Okay.
So it binds with the teeth. It displaces calcium. I won't go into the biochemistry of it, but it displaces calcium, binds with the teeth, makes it stronger, more resistant.
That is fluoride.
On a personal level, I have attended to families. Toothpaste is a family thing. Once it's in the bathroom, everybody
uses the same paste.
It's very likely that what affects mommy affects daddy, affects the whole kids. Okay. So I have seen families come down with cavities. The whole family of 5, family of 4, family of 3,
and they are all
couples and having similar problem. What toothpaste do you use? And they tell me, oh, I use this. I use that. And I'm like, well, this toothpaste doesn't have fluoride. Oh, I didn't know. They pushed it in the market for us.
Okay. I see.
Now to the other side.
So it means that we should look out for toothpaste with fluoride.
Always.
Okay.
To prevent cavities.
Okay,
good.
So if you have cavities, your dentist is thinking something else.
Okay.
And not going straight to the fact that
okay, great. Okay, so.
But excess of it though, that's where you have issues.
But how do we know about excess?
Excess of it will be.
Some people swallow toothpaste.
What for?
Whether you like
it. For what reason?
They
just like the taste. Some people like it, some people go.
I just
But when you brush, you're supposed to rinse.
Out properly.
You rinse out properly. So you have that accumulation of, and then some places too that have this systemic water supply. Like in America, they put some nutrients in the water. Fluoride is one of them. But if you don't get the concentration right, you might have fluoride toxicity. And that could cause other things. But one of the things that we see in practice is called mottled enamel. The teeth just look funny. They have brown stains and pigments.
Yeah.
No matter how much you brush, it's not going anywhere. And structurally, it's deformed, subject to cracks and all that. So it's not.
So that may be as a result of excess fluoride or something?
Yes, definitely.
Whoa.
Amongst other things.
And other things.
Wow. All right. So a lot of people experience gum diseases without realizing it. What are the early signs and how can it be treated or prevented? You talked about brushing often, but what do we begin to experience that would be red flags and saying there's time for you to see a professional?
Okay, for gum diseases, so you have that plaque accumulation. It's all about the bacteria, really, and the dynamic. There has to be a balance.
What would you feel? Pain? Or you notice, what would happen to you?
Yes, so what you start experiencing is bleeding. One of the signs of it's just basically inflammation. So you start to experience bleeding, you start to experience pain, a dull ache. A dull aching pain, as opposed to a hole in the teeth. A hole in the teeth is sharp
pain.
It's unmistakable to the point it could disturb your sleep.
Your headache is banging.
When I was talking earlier, I saw you holding your mouth. I know you've had this experience before. But it's terrible. But the other one is from the gum disease. Is actually bearable. It's just at least it's an ache. So you floss, you do that, it goes. But the destruction continues. So you need to see your dentist, really. See, the gum disease, when you brush, you spit out, you see blood. It has started. Inflammation has started. So you spit out, you see blood. That's one of it. Then you start feeling dull aches. So go and see your dentist. That's what he's telling you.
Just see your dentist.
Just see your dentist.
We've talked about basic things about the tooth. So sometimes we want to go the extra mile, so we now have cosmetic dentistry, which is like growing in popularity, So what would you say are the safest and most effective ways to whiten your teeth without causing damage, for instance, and other means of cosmetic dentistry that you experience?
Okay, so to whiten the teeth, there are indications for it. Some people have it as elective for elective reasons. Some broadcasters like yourself want that $1 million smile on camera. Celebrities. So to get that, we have different ways to go about it. So one of it is tooth bleaching or teeth whitening.
Okay.
So that's just, you just put a chemical, activate it, enhances the color of your teeth. So you can do that in the clinic, then we can give you a kit that you can use at home.
Okay.
Yeah, so that's one of them. Another one is veneers or crowns. So for that, the teeth is filed a little bit, and then a material is, is worn on it. So you wear
that
it.
will last long. That will
as
last
of,
long.
for as long, it's cemented, and then you have it. And
So
it
Helen,
look like Davido.
Yeah? What happened to it? No.
we can give you some crowns.
Why is it Helen?
Yeah, the celebrity now. He talked about celebrities.
Okay, we're almost out of time. But before we go, let's look at, the transformation in technology. What have you got to say? Looking 5 years ahead, what new things, innovations are we looking at? The laser dentistry, AI assisted, all of that.
Okay, so I would say, well, some clinics are giving very advanced care. AI just helps with diagnostics, really. And, studies are being done. They are using robots now to do some dental procedures. That's basically, AI helps with diagnostics, but a robot will not cut your cavity. You won't trust a robot, not at this time.
Okay.
Yeah.
So as they continue to do more studies, more experiments, maybe they can get to human trials. But for now, AI still has a while to go in dental practice.
Okay, so to somebody, that person out there who has been taking care, so to speak, in quote, taking care of his dental health by himself and herself without seeing any dental whatever for so many years and has no issues, what would you say to that person looking at this camera?
There's nobody that doesn't have issues with their teeth. It might just be, subtle. There could be a time bomb ticking. Don't ever think you are nobody. It's a field on its own, and you shouldn't trust your own knowledge in that regard. So the knowledge is out there. Go and see your dentist every 6 months. You just never know.
Okay.
You never know what's lurking. So it's better you treat it now. It will save your pocket. It will save your health, and you have a wholesome life.
Okay.
Wow.
All right. And my appeal is that please, you and your colleagues, reach out more to the people in the communities. Those ones who think that the train stick, Yeah, and with the dental clinic there, and they're passing through, like you said, maybe with more information and enlightenment, because they are a large population that we cannot turn our backs on. Yes, overlook them. And thank you so much for coming on the show today. I have really, some of the things you said that scared me. I'm really guilty. I eat late, and it's not every day that I take care of what I'm eating before I go to bed. Sometimes 12 midnight, I'm still chewing something. So I have taken note, and I will make some lifestyle changes. Thank you.
This sounds like a real life confession.
I'm telling you.
Right.
All right, we'll take another break very soon, and that break will then enable us make way for our next guest. So don't go away. We will be talking about John.
The gender agenda.
Gender agenda.
We're looking at the scorecard.
The scorecard.
When we come back from this.